My name is George Smith. I'm an intern at the UT Health Medical Research Center, and I'm going to be covering SI joint dysfunction and stabilization. So the SI joint stands for the sacroiliac joint. The sacroiliac joint is a synovial plane joint that is located anterior to the posterior superior iliac spine of the ilium and is reinforced by a thick set of ligaments. It functions as a stress relief mechanism within the pelvic ring and a stable means for a load transfer between the exoskeleton and the lower limbs. Force closure. Force closure, which is also known as self-bracing or self-locking, is when other forces are acting on a joint to provide stability. Muscles and ligaments contribute to the force closure and is important when performing different activities such as walking or running. A few of the ligaments involved in force closure are the sacrotuberous, sacrospinatus, interosseous sacroiliac, and the iliolumbar. A few of the muscles involved are the latissimus dorsi, the gluteus maximus, and the biceps femoris. So I'm going to be covering SI joint dysfunction. So the definition of it is pain caused due to the improper movement of the sacroiliac joint between the sacrum and the pelvis. It can be caused by either traumatic injury, arthritis, or pregnancy. For arthritis, it's the wearing down of the cartilage layer covering the bone. And during pregnancy, the altered gait associated with pregnancy can place additional stresses on the SI joint. Symptoms of SI joint dysfunction most commonly is SI joint pain. So pain in the lower back of the hips, lower back or back of the hips. Pain is normally hard to pinpoint, and special tests are run by providers to figure out the location of the pain. Treatment for SI joint dysfunction. SI joint pain is often related to too much movement or not enough movement. In physical therapy, treatment of the SI joint can be performed through a variety of stretching and stabilizing exercises to help straighten the joint and provide stabilization. Other known treatments would be steroid injections, oral anti-inflammatory medications such as ibuprofen and naproxen, and in rare cases, surgery. So as for treatment in a physical therapy clinic, the stretching exercise will be consisting of a single/double knee to the chest, stretching, supine trunk rotation, child pose, and a cobra. A couple of the stabilizing exercises would include the bridging and bird dogs. In conclusion, the SI joint is multifunctional and is a necessity in order to perform day-to-day activities. And to maintain healthy functioning, performing exercises such as stabilization and stretching, as well as strengthening of the lower back and hips, can help prevent problems such as SI joint dysfunction.